So, good evening. Good evening, everyone. I'm Dr. Dheeraj Nanavati. I will be the introducer today on behalf of Dr. Srivastav. It is a pleasure on my part to introduce to you Dr. Dheeraj Nandanoor.
Hello, everybody.
Yeah, the most important field of medicine is internal medicine, because an internist is in the center as far as any patient's care is concerned, and all the other specialists are like surrounding the patient care. Dr. Nandanoor graduated from Hyderabad, and he did his internal medicine at Mount Sinai Medical Center in New York City. He is in practice here. His practice is called SynergyMed, and he's affiliated with quite a few hospitals here. His main goal is to make sure that a patient gets intervention and care for whatever medical condition they have as soon as possible. And his goal is to make sure that patients return their pre-illness status as quickly as possible and are healthier and happier than what they started with, which is a great goal. So without much ado, I would like to introduce to you Dr. Nandanoor. Please take it away.
Hello, everybody. I'm Dr. Nandanoor, and thank you, Dr. Nanavati, for introducing me. And I would like to give you a few highlights as to how you can help yourself stay healthy. I usually deal with patients 18 and above, and mostly deal with elderly patients with multiple comorbid conditions. So today I'll just give you a preview as to how we can prevent medical conditions from worsening, and also, as Mr. Jalota was mentioning earlier, the comparisons of how I am doing now and how I was doing in the past, and how I can prevent the thing from worsening and get it better with some either medications or health tips like diet and exercise. So usually, although we call it an annual exam is something which we do in elderly population above 65. But in the younger population, 18 and above, a yearly physical exam would also cover almost all the lab tests and examination, a complete physical examination of the patient, to see if there is anything that we can do to reverse the underlying medical condition. If the young person has any, if he doesn't have any, we just educate him about how to help him stay healthy in the long run. So in an exam, what we do is, in annual exam, for example, we order the labs, we check for the cholesterol levels, we check for HbA1c, which is an indicator of 3 months of blood glucose levels. We check for CBC and kidney function and liver function. CBC helps us in knowing if they have any underlying anemia or any platelet issues like that going on in them. And depending on the age, for example, if it's a young male or a female in a sexually active age, we order specific tests for them by taking their consent. We order some lab tests like HIV panel, gonorrhea, and syphilis, which are pretty common in young individuals who are sexually active. And depending on the family history, we order the mammograms. That's the second part. It's in the females. For example, if they have a family history of breast cancer, we order the mammograms 10 years younger from the age of the other family member. When, for example, a mother had breast cancer at 48, we try to order the mammogram around 38, and also do some genetic testing to see if there is any genetic causation for the breast cancer. Otherwise, we usually start mammograms at the age of 50 and usually do it every 2 years, unless otherwise indicated, because mammogram by itself is also an exposure to radiation, and we keep it that way. And colonoscopy. Previously, just 1 year ago, colonoscopy was recommended above 50 years of age. Again, the colonoscopy indications vary. For example, if it's a if a patient with a family history of colon cancer, just like in breast cancer, we try to order the colonoscopy 10 years before the first degree family member colon cancer age. Otherwise, right now, we will be ordering colonoscopy. I mean all the internal medicine physicians. We should be ordering the colonoscopy at the age of 45. The colonoscopy is one of the best tools, gold standard, in preventing colon cancer. Colon cancer is one of the very preventable cancers. And at 45, if we see polyps, depending on the number of polyps or kind of polyps, we order the repeat colonoscopy. And internal medicine physicians from our in our field, we try to keep it every year. We check it and inform the patient as to when to go and get it. Although the gastroenterologist will also put a tab on it. It's very important to prevent colon cancer. Colon cancer, if it happens, it can lead to comorbidities, even colectomy, where they have this colostomy bag with them. We don't want the patient to go to that extent. That's why we do this colonoscopy, and every year we do the FIT. Some patients who don't want the colonoscopy procedure, there are some new tools that we have, and we order like Cologuard. We order them, and that way we can track it, but it still is not the gold standard. Colonoscopy is the best way to prevent colon cancer. And in the annual exam, we do the complete examination. We do the EKG to see. Every year I do the EKG just to make sure that there are no changes when compared to the previous EKG, because that does give us a baseline value of the EKG. EKG is the electrical conduction of the heart interpretation. If there is any abnormality, any new change, we immediately send them to the cardiologist like Dr. Rena or anybody to have a look into it and do the necessary tests if needed. And we do the lung examination with spirometry if they have history of asthma or smoking. And we have the baseline, and any changes, we titrate the medications to help them stay fit and stay healthy. The medications are titrated as per the need. If it is asthma, there is a step-up medication, and if it is COPD, there are some, depending on what stage they are at, we order the medications. The main purpose, as I briefly told you in the earlier slide, is to prevent things from happening in patients. That is what we do. Vaccinations, they are ordered as per the age, and there are different vaccinations like pneumococcal vaccine, tetanus vaccine, and flu shot is every year, which everybody is familiar with, but it's important to get the flu shot to prevent any worsening conditions. And it's our duty. We usually explain the patients the importance of these vaccines. And there are other vaccines like meningococcal vaccine, which we usually give with any underlying condition. So when you go to the doctor, he would evaluate all these underlying conditions, and depending on the underlying conditions, the administration of the vaccines differ. But as a general rule, the tetanus booster is given every 10 years, flu shot is given every year, and the pneumococcal vaccine is given at the age of 65. These are the important vaccines. And if somebody is not immunized to hepatitis B, we do the panel and educate them and give them the hepatitis B. If somebody is traveling outside the country, we, depending on which country they are traveling to, if they didn't have hepatitis A immunization in the past, we give them hepatitis A immunization. And also, depending on which country they are going to, we give them the medications to prevent malaria. So one of the important things that we deal with in patients above 65, it's in general, but before that also there are indications to check for osteoporosis. What is osteoporosis? Osteoporosis is weakening of the bones. A bone is a strong structure, which you can see in the picture, like they are solid structures, but osteoporosis is like a bone, if it is a solid element, in osteoporosis, it appears to be like a sponge. That is how it appears to be. And that's when the weakness happens, and that increases the risk of fractures. Where do these fractures happen? The common sites are backbone, and also most importantly, the hip area. And that will be debilitating, and it's not good for the patient, because it is going to affect the long-term prognosis, and it can lead to other problems in the patient because of being debilitated. So one thing we do is to screen for osteoporosis, we do check into the family history. In the family history, we see if there is anybody that had history of fractures, we have another score called FRAX score. We deal with those mostly in the females or in the males. And also we see the medications. For example, patients, if they're on steroids, like for example, if the patient has history of prostate cancer and he is on some medications, then there is increased risk of bone desorption, and that can lead to fractures. So to diagnose it, we do the DEXA bone scan. The other indications are obesity also increases the risk of osteoporosis. The same way, underweight, BMI less than 2019 also increase the risk of osteoporosis in patients. So with all these, we take all this into consideration and we do a bone scan. In a bone scan, we get a score. So where it says bone is strong or osteopenic or osteoporotic. Osteopenic is not a weak bone, but it's not a strong bone. It's in between. But we can prevent this osteopenia from becoming osteoporosis, that is like weak bones. So for that, when we see that, we usually, one of the best ways to prevent osteoporosis is physical exercise. You can, if you exercise, it is proven to help prevent osteoporosis and also help strengthen the bones. The second thing is, if it is calcium and also vitamin D supplements, depending on the medical history, we give them the calcium and vitamin D supplements. If they're osteoporotic, we have medications like bisphosphonates, which we give them, and again, check for the bone strength again in 2 years. But usually bisphosphonates are given for 5 years. And then we give a drug holiday. But in between, if they have any more fractures during this 5 years, or if their bone scan T-score is not still improved, then we continue the bisphosphonates. Now, the next important thing is cholesterol. It can be a young patient or an older patient. Cholesterol by itself can cause multi-array of symptoms. For example, if you see this blood vessel, the blood is flowing in a clean way. But when the cholesterol in the body keeps increasing, it'll just get accumulated and it forms a plaque. And plaque is something which activates the clotting system. The platelets get activated and they form a clot sometimes, and it can get dislodged and it can lead to stroke, heart attack, which are very bad. So where sometimes with the stroke, patients can lose, can have weakness, irreversible weakness too. Heart attack, which it is something which can sometimes lead to a bypass, or it can be just a cardiac intervention with the cardiac cath. But even then, we can prevent this by taking care of our cholesterol levels. So for this, although you feel healthy, there is a risk that your cholesterol levels may be elevated. So yearly getting a cholesterol examination would actually prevent the patients from going to an extent where they have their heart or brain attacked by this cholesterol. So there are different reasons why the cholesterol can be elevated. There is something called familial hypercholesterolemia because of the family history. There can be underlying medical condition which can lead to cholesterol levels being elevated. Some medications can also cause it. And in the cholesterol also, there are different components. For example, triglycerides. If the triglycerides are high, they can go and damage the pancreas, and that can cause problems and also damage the whole body with the other things that I mentioned before. And the LDL, with total cholesterol level greater than 220, is hyperlipidemia. And there are subcomponents. One of them is triglycerides, the other one is LDL. LDL is low density lipids, which also increase the risk of heart attack and stroke. HDL, the component that you see on your labs, is the protective cholesterol. People who exercise at least 150 minutes in a week, they tend to have high HDL being elevated, which is protective. And also sometimes in some patients, it can be the family history where they have good HDL levels. But it's also important to see and prevent the LDL and triglycerides from going up. How can we prevent LDL and triglycerides from going up? One of the best ways, proven ways, is DASH diet, which I'll explain to you after I explain about hypertension too. So other ways is, if they are not getting under control, then we give the medications called statins. They are the first line. And the side effects of statins sometimes could be muscle pains, which is common. And also, if sometimes one of the other side effects is elevation in the glucose levels. which is minimal, but we check on it on a regular basis. If somebody has intolerance to statin, there are other medications right now in the market, including Statin, which is actually helpful, has been shown to be helpful in patients with statin intolerance. There is ezetimibe and these other medications. And in cases where there is familial hypercholesterolemia with severely elevated cholesterol levels, lately there has been a new drug which has been approved, inclisiran, which actually helps in preventing it, getting the cholesterol levels really down. And the study was very fruitful and it was very good. But it's a very costly drug. If the doctor shows that there is a need for this, there is a good chance that the insurance will approve, and it's usually given as an infusion. Coming to the diabetes. Diabetes is elevation in the blood sugar levels in the body. So the blood sugar levels, if they are elevated, it's called diabetes, and there are different kinds of diabetes. Type 1 diabetes, it's previously was thought it could be because of the hereditary factors, but it's not 100% proven, but it can be it's usually because of autoimmune mechanism, the system fighting against the pancreas. And it usually happens at a younger age, and the treatment for this condition is insulin. Type 2 diabetes is the most common thing, the kind of diabetes, and easily preventable also. And the other one is median. There are many other types. One of the important ones are median onset diabetes of young age. Sometimes the patient can be in the 40s and 50s, and still some patients may have a question like, I'm 40 years old or 50 years old, so I have type 2 diabetes. Not really. They still can have type 1 diabetes. So we do a screening with a test and make sure that it's not type 1 diabetes, it's type 2, because it's important, because for type 1, insulin is the treatment. For the type 2, there are many good medications right now in the market. So in type 2, our goal would be to prevent the patient from going on to insulin. Rather than that, give him some other medications which are there in the market, like metformin, which is proven to be very helpful, and a GLP-1 inhibitor or SGLT2 inhibitor, which all work in a very nice way and also help in controlling the diabetes, not only diabetes, but also other conditions like heart conditions and also non-alcoholic steatohepatitis. It is proven that these medications do help. And one of the most important things is obesity, one of the major risk factors for diabetes, because obesity increases the risk of peripheral resistance, and then it increases the risk of diabetes. And if somebody exercises and keeps their weight in target, the chance of them getting out of diabetes also improves substantially. So that's one of the important ways to help yourself from getting into diabetes. Diabetes is a slow poison kind of disease where it slowly starts damaging your eyes, your nervous system, and also increases the risk of diabetes and also hypertension, and increase the risk of coronary artery disease, which means increased risk of myocardial infarctions, that is heart attacks, and also increases the risk of kidney issues. So all this together, the best way to prevent diabetes from happening is exercising and keeping your weight in check. If diabetes happens, keeping a regular tab on your HbA1c and following with the primary care physician, and also getting a yearly eye exam and a foot exam is strongly recommended, because the nerves, because of diabetes, once they are damaged, it's better for you to get the foot exam done regularly to prevent anything from happening. My family member, he had a below knee amputation just because of him not taking care of himself and getting an injury, because they don't know that something happened, because they don't have sensation, and it can lead to really bad infections, which can lead to gangrene and amputation of the foot. Hypertension, basically, it means it's the pressure exerted by the blood on the blood vessels. There are different conditions that can cause hypertension. For example, if somebody is obese, it can lead to angiotensinogen release, which can cause hypertension. Angiotensinogen is a hormone that can cause effect on the blood vessels and increase the blood pressure. And hypertension can cause different issues, just like diabetes. It can increase the risk if it is not controlled. It can increase the risk of stroke. It can increase the risk of heart failure and myocardial infarction. And it can also increase the risk of kidney issues, hypertensive nephropathy. And it can also increase the risk of vision loss. Now, coming to sexual dysfunction, diabetes can cause it, hypertension can cause it, the sexual dysfunction that can happen. And how can we prevent the hypertension from happening? Same answer again, exercise and diet. Every day exercise, at least 150 minutes of aerobic exercise per week, and watching a healthy diet would actually prevent the diabetes, hypertension, and hypercholesterolemia from happening. So the diet that I was mentioning about earlier, it's called DASH diet. It's similar to a Mediterranean diet, and it has been proven to help patients in controlling hypertension and also in helping them control diabetes and also hyperlipidemia. It mainly has high fiber in the diet. So that actually helps. For example, our Indian history also, maybe everywhere in India, we used to have more vegetarian diet, more high fiber diet. But with the culture change and everything, people are getting into these burgers and all this, just showing a small cohort of Indian culture. And that is actually increasing the risk of obesity, which in turn is increasing the risk of diabetes and also hypertension and also hypercholesterolemia. A healthy diet with good fiber and good vegetables and timely eating will actually help with a lot of factors, including osteoporosis, diabetes, cholesterol, and hypertension. So this is one way of, without taking medications, you can prevent. You don't want to take medications. Medication should be the last resort. Instead, you can do, a person who can exercise and can follow a healthy diet will actually help himself by preventing all these conditions from happening to him or her. Lastly, smoking and alcohol. So if you see this picture down here, this is a smoker's lung, and this is a lung of a healthy individual. Just the same way, if you take a smoker's, for example, if the half of the face is a smoker's face and the other half is a non-smoker's face, you can see wrinkling and aging earlier in a smoker, but not in a non-smoker. And also, smoking increases the risk of all kinds of cancers: lung cancer, pancreatic cancer, bladder cancer, kidney cancer, you name it. It increases the risk of all of these, along with the risk of hypertension and increase the risk of stroke and heart attack. So there are very good medications right now to help prevent smoking. And also you can help yourself by quitting smoking to prevent anything from happening. This is a small chart which says how you can, if somebody is smoking, if they quit smoking, how it'll improve their overall health status. To be frank, in just really 2 to 3 months, the blood pressure and everything almost come to normal. It's just the first few hours which you need to fight against smoking. And then after that, it becomes a healthy thing. You start waking up early. You feel like you're having better energy levels. You also decrease the risk of cancer within the 5 to 10 years stretch. It decreases the risk of heart attacks within a few years stretch. And all of this, and within 48 hours, you'll start enjoying your food. Yes, some people keep asking me, some of the patients, that I gain weight. So what can I do about it? You gain weight, but your lung capacity has improved, so you can exercise better. When you exercise better, you lose that weight again, because people correlate smoking to weight. Some people think if they smoke, they don't gain weight, but that's not true. And some patients think if they quit smoking, they'll gain weight, which can be true because they start enjoying their food. But at the same time, their lung capacity is improving. And with that way, if they exercise, they will lose that weight back and they'll feel healthier, be more active in their work, and be achieving in their work. Coming to alcohol, this is one other thing that is pretty common in the young individuals these days, both alcohol and smoking, because they think it's possibly the peer pressure. Smoking, sometimes patients come and tell me, young patients, that they're smoking. When I ask them, are you smoking? They say no. then when I specifically asked them, are you smoking marijuana? They say yes. Marijuana, as of now, there are no proven side effects of marijuana as of now. But there is something called demotivation syndrome that can happen. So, but at the same time, it can also, nobody can get addicted to it, but the young generation, they usually mix this nicotine with this marijuana, and then they smoke, and they get addicted to it because it's the nicotine that's getting them addicted to it, and that's going to cause all these problems. The other side effect of marijuana, which I explained to my patients, is they can have cyclic vomiting, which can lead to electrolyte loss, which can lead to effects on their heart, and that can be dangerous. Coming to alcohol, alcohol almost does the similar thing. It causes nerve damage. It can cause you to be less efficient than you can normally be. It increases the risk of heart issues, and mainly it can cause liver cirrhosis, that is liver cancer, and also can cause alcoholic kidney issues. So these two can be prevented. And usually when they come to us, and the patient tells us that they smoked for this much of time, and we usually start screening them for lung cancer at the age of 55 with the CAT scan, low-dose CAT scan, to see if there is a risk of, if there are any nodules that are present in the lung. And we follow up, depending on what kind of a nodule is there, we follow up with the CAT scan, and we follow up regularly to make sure that it's not becoming cancer. Alcohol wise, it can, as I said, it can lead to all these issues, but we mainly also are concerned about the liver cancer that can happen with alcohol. And there are medications which are there to help patients quit alcohol and also smoking. So when they tell us, we give them these options, explain them what are the benefits of quitting, and explain them the risks of alcohol and also smoking. If anybody has any questions, I'll be more than happy to answer those.
Well, Dr. Nandanoor, that was an excellent overview of a person's health. It shows how internist is able to look at an overview picture of a patient's health and keep everything in line. I have a couple of questions for you. When do you did not mention anything about pap smear in female patients. Can you make some comments on those?
Sure. So the pap smear, we usually start at a young age, and initially we send them to the gynecologist. We don't do the pap smears. We send them to the gynecologist, and depending on the type of screening that they do, usually is followed up in 3 years to 5 years. So pap smear is usually done around 20 to 30, or as soon as they start females start having sex. So it's again a case by case basis, but once we start it, it's done every 3 to 5 years.
Nice. And colonoscopy, did you say that you do fit test every year, and then if indicated, you recommend colonoscopy, or can you clarify that protocol a little bit?
Sure. A fit test, basically, if it is positive, that means something is brewing something might be brewing in the colon. It can just be positive with the hemorrhoid too. But the colonoscopy, I would recommend strongly at the age of 45 for sure, to see if there's anything brewing in the colon, and then follow up with a fit test. And as I said, depending on the polyp, is it a sessile polyp, or endomatous polyp, or how many polyps are there, what is the size of the polyp, we repeat the colonoscopy. In the meanwhile, it can be 1 year, 3 years, 5 years. In the meanwhile, we do the fit test to make sure that the colon is. So patients ask me, if I'm doing the fit test, isn't it enough? No, fit test can miss. If it is something, there is something happening, it can be positive. But if it is negative, it doesn't mean there's nothing happening in the colon.
Can you clarify a little bit more about DASH diet? You did say high fiber content. What else?
It's a Mediterranean kind of diet. Basically, most importantly, it's more fiber in the diet, and fish, and avoid red meat, and this kind of diet. Yeah.
Okay.
Dr. Nanavati, Sonia has a question. She raised
Go ahead. Yeah, please go ahead.
Sonia?
Yeah, Miss Sonia, go ahead.
Unmute yourself. Sonia, unmute yourself if you have a question to ask or type
Yes.
it in. Okay, she raised her hand, but I don't see. I think Satish ji has a question.
Yeah, Satishji, go ahead, please.
No, I don't. I didn't raise my hand.
Oh, okay. Sorry.
No,
I saw it
no.
unmuted, so I thought.
No.
Okay, yeah, I'll go back to where Dhiren Bhai was on the DASH diet. If you can please share some more information on the DASH diet,
Sure.
that seemed really interesting.
Sure. I will send an email to you, Virtu, and maybe you can share it with the group.
Oh, okay, sure.
While we are waiting for others, Anil, maybe I can ask one more question.
Sure.
Especially in our area here, which is a wine country, consumption of alcohol is considered a part of social life. So I'm sure you don't mean that one should not consume alcohol at all. So what kind of guidelines do you provide? How much, how often, et cetera, et cetera?
That's a very good question. Thanks for asking. So it's not like anything in moderation. Anything in moderation is good, except for smoking. Smoking, not at all. But anything in moderation, wine, beer, as per the guidelines, they say maybe 4 beers in adult and 2 beers in the females. I'm not 100% sure about the correct exact number, but there is a guideline as to how much they can drink in a week, or one 90 ml of scotch in a day. That's how it goes. There are specific things. So as long as you are within the norms, like 1 to 2 glasses of wine is not harmful. So when it goes beyond, that is when it starts taking its bad effect. There are some alcohols that also have good effects on the body. Wine has, they were saying that it's still not proven, but they say that it's helpful for the heart. But it again should be in the moderation, like 2 glasses of wine. Is it 100% that is going to help the heart? Not 100% sure. As I said, in 1960s, American government promoted that cigarette smoking is good for health. They even promoted on TV saying that cigarette smoking is good for health, and Camel company, it said, the doctor recommended cigarette is Camel. So that's not true. So I always have this thing, depending on, but anything in moderation like wine and this should be fine. Yeah.
Yeah. Now, Mr. Jalota had touched on a very important subject. If you are in a system of care like Kaiser or Stanford, usually the medical chart tracks all your lab work and all that, and you don't have to do it yourself. But for people who go to outside practices, which do not necessarily have the medical records like bigger institutions, how do you recommend them? They keep a tag on their lab work.
That's a good question. So basically, I have the same system as Stanford has, and also as Kaiser Permanente has. It's called Epic.
Oh, I see.
So basically, we give them the Epic My Hill chart access, and they can track their labs. They can see their labs, and if they have a question, we can have a video visit or a phone visit, or they can come to the clinic and ask me questions. I'll be more than happy to answer those questions.
Oh, I see. Is Sonia ji back?
She said by mistake, but Sharad has a question.
So there's
Go ahead.
nice talk. Had a quick question. What's your opinion on caffeine intake and quantity or?
Dr. Arora, yeah. I think 1 cup of coffee a day is good.
1 cup?
1
How
cup.
about these youngsters that drink either the monster drinks or
Not
their
at all.
workouts?
Yeah, that's a very good question. So I come across these situations. They come in, their heart rate is high, their blood pressure is high. The first question I go to in young people is, did you have Red Bull or did you drink a lot of coffee? Either of them comes true, right? Red Bull, I mean, all these energy drinks. And I tell them it's not good. You don't need this energy because this caffeine will make you feel as if you have a lot of energy, but you will crash too at the same time. In the meanwhile, you're affecting your blood pressure and you're affecting your heart rate. So keeping them at bay is the best way to stay healthy. And caffeine in moderation, maybe 1 cup of coffee per day, not the big Starbucks coffee, which is like Venti, I guess. I'm not sure.
Grande.
Grande, Venti, something. They have their names. Just a small grande with a little milk, not black coffee, or a smaller one, black coffee. Black coffee also is proven to help in weight loss a bit. Just 1 cup though, not a lot. That would help, is what I think. But you are the expert in obesity medicine. You know it too.
Thanks.
On that same note, many of us from our background, we drink 2 cups of chai a day. Is that healthy or not?
I mean, a chai, see, the way Indians drink chai is not like the Venti and Grandes. We just have a small cup of chai. And the chai is actually helpful compared to caffeine, coffee. Chai has better effects, healthier effects, and less caffeine in it. Especially green tea is very helpful. It has antioxidant properties, and that has good thing in it to help with different things in the body.
Great. Thank you so much. It's been such a wonderful talk.
Thank you.
Thank you.
You did mention smoking, but I would just like to point out that for the audience, at least in some senior people, there's a tendency to chew tobacco, and that's worse than even smoking. Quite often, चाय के बाद पान खाते हैं या तो खाना खाने के बाद पान खाते हैं. So pan itself is not harmful, but if you have a habit of putting tobacco in there, that's a pretty dangerous thing to do. Do you agree?
I totally agree. I mean, the best way for them to see it, I mean, if they are watching Indian movies, the starting it comes, they get their tongue taken out. And there is this guy who shows that he has been chewing tobacco for a long time. Oral cancer, different kinds of oral cancers, high risk with chewing tobacco. And that can be very devastating. Yeah.
Very devastating, yes.
I have a question.
Go ahead, Mr. Jalotna.
Yes. Dr. Nandanoor, when a patient comes to your practice, after you've seen the patient, do you give the patient a copy of the visit? You came for this purpose and this is what we recommended to you. You can take home that chart and your office keeps that chart. So that way you have a track record, a printed tab record in your office and the patient has it. The reason I'm asking is that I used to go to a practice in Tracy, which is a good 20 miles each way, where the physician for last 8 years gave me that chart at the end of the visit. Within 20-25 minutes, wait in his office, gets your chart. However, I came to Stockton, I changed my physician because driving was too long. Here is only 5, 6, 7 miles, but I never got a chart from the physician. However, to overcome that habit that I was used to having the chart, I created my own handwritten notes and put in my PCP's file so that I know when I visit the next time what I had gone for, what I got from the PCP, and what more questions are going to ask him. Why so much variation from practice to practice?
I can't put an umbrella as to every practice is like that. Some practices do it differently. But what I do is, I can talk about myself. What I do is when the patient is, after I finish the visit, when the patient is leaving, whatever diagnosis I discussed about, it'll be put in there. And if I said DASH diet, as I said earlier, I'll print out the DASH diet and give it to the patient. And how to help other things, I print it out and give it to the patient so that they know. And regarding the labs, I don't print out the labs, but why? Because it'll be a lot of waste of paper. That is what I think, because we already have it in the computer. But I tell my patient about the chart, my chart, where you can go in on your computer or on your cell phone, and you can see all your labs. And if you have a question, you can email us back. My manager would see if it is relevant. She will forward it to me. I see it, and we respond to the patient regarding that specific question. So, and that way you also can keep a track of your labs. You don't have to write them down. You can just see on the computer. It'll say last time I did the HbA1c in November, it was 6.4. After we discussed and you followed a DASH diet and followed a low carb diet and exercise regularly, and basically in March, you checked your lab again. It'll show you the trend. From 6.4, it went down to 5.7. So you're improving. That's a motivation too. That will help you continue.
Exactly.
With the way that you're doing right now, with the way you changed, and that'll help. Yeah,
exactly. Very good. Good.
Okay.
Thank you.
I don't see anybody else having any questions. Any other comment?
Anika ji has made a comment, a very nice and informative talk, and she has thanked.
Thank you. Thank you, Ms. Anika.
Dhiren bhai, please take.
Yeah. I guess I would say that it was a very well done overview of a person's healthcare. Primary care physician, as I have mentioned before, is the pivotal physician in healthcare. I'm glad that Dr. Nandanoor is focusing on overall health and provides early intervention, and his goal is to make sure that patient reaches his illness status as quickly as possible. So having said that, I think we can conclude the program. What do you think?
If anyone has questions, please ask now. You can unmute or type. And if you don't have a question, we are going to end the talk for today. I think, Dhiren bhai, go ahead and.
Okay. Thank you very much, Dr. Nandanoor, for spending your precious Sunday evening with us. And hopefully members in this group have learned a lot from your presentation. Thank you and good evening.
Thank you, Dr. Nawadi. Thank you, Vartu, for giving me this opportunity. Thank you very much.
Thank you. Thank you, everybody. Thank you very much. Thank you.